Faecal calprotectin is a protein test that allows you to detect inflammation going on in someone's bowels. So if it's normal, there's no inflammation going on. If you have inflammatory bowel disease, be that Crohn's, colitis or any of the other varieties, then it will be raised. The patients will get seen and treated in primary care. They will avoid a referral up to the hospital. They will potentially avoid unnecessary investigations in secondary care. Basically, the right patients will go into the right place for the right reasons.
The symptoms are very similar for IBS and IBD. And so it's quite challenging for a GP to understand whether that person needs to go to hospital, whether they can be managed within a GP practice. And so by implementing this pathway, there's a step-by-step guide for them to understand how severe a patient might be, what they can do and how they can manage that patient more effectively.
I was going to the toilet quite frequent and then it started progressively getting worse, and it got to the point where I was getting really pale. So I eventually contacted the doctor and he told me to do this stool sample with the Faecal Calprotectin, and it was like, I'll get back to you in a week. However, he rang me 2 hours later to go to A&E. It puts your mind at ease. Like, obviously it's a bit of relief. They know what's up with you and they can now start treating you, start getting you better again.
We know that 49% of people with Crohn's and colitis wait more than a year for a diagnosis. In the meantime, the anxiety and dealing with distressing and debilitating symptoms can really take a toll, both physically and psychologically. We're working with the Royal College of GPs to develop resources and run education sessions to help GPs support their patients with Crohn's and colitis better. One example is the GP toolkit that we've developed, which is effectively a one-stop shop for guidance and top tips on identifying and managing Crohn's and colitis.
Our future hopes are that this will become something that's used in the whole of the country, not just Yorkshire and Humber. We are developing this as part of the HSN network, so all 15 HSNs in the country hopefully will be rolling this out, and this will mean that anywhere from Cumbria to Cornwall will be able to have access to this pathway, so it'll help every patient in the country.